I was asked to come and talk today about kind of a newer concept called condition-based bundles, which is a value-based care concept that we're working on at Dell Medical School, kind of trying to move from that next generation of procedure-based bundles around hip and knee replacement, which is what CMS has been experimenting with at this point, but a concept that we think is actually going to be a more useful payment system in the future, which is to actually create bundled payments around medical conditions that we treat. It's an interesting question, and actually, so the title of my talk is Healthcare in 2025, and so I've been kind of targeted on thinking about the 5-year horizon, the 10-year horizon. Similarly, I think the burden that we're really going to have to undertake as a medical profession, and for patients too, is how do we embrace and bring on new technology in a way that's going to be financially sustainable. And so, we really have lived in a world of exponential technological growth, both on the side of the way we look at data, but also, devices and the medical advances that we see, and many of them can help people live longer, they can improve people's quality of life, and so we don't want to suppress the technological growth that we see, and the United States is really the driver of that for the other medical systems around the world. But at the same token, the way we're currently paying for it is actually unsustainable, and it's pretty clear that that's the case. And so I really think the next 10 years is going to be about how do we bring healthcare delivery and the science around that together with new technologies as we bring them on and start to look at things a little bit differently. So when a new thing comes on the market, we have to be a little more clear that there's a return on investment before we have widespread adoption throughout the system. TOA is really at the forefront. I guess I would start by saying that as a person who, I'm from Texas, but I spent a lot of time living in New Hampshire, and I was part of the New Hampshire Orthopedic Association, and so TOA really is a leader in state orthopedic organizations. They're recognized around the country as having a great political voice, really being involved in the way health policy is delivered in Texas, helping our patients as much as protecting our profession. And so I think TOA remains a leader and being engaged with the leaders in orthopedics around the state, and really making sure that we're there delivering the voice of the patient at every policy decision that's coming before our legislature is an important part. I also think it's a great organization for bringing us together and actually learning as a state organization and how we can be represented on the national scale as well, and how we engage with the American Academy of Orthopedic Surgeons, the National Orthopedic Leadership Conference. The TOA really does stand at the forefront of state organizations in my mind.